Thank you, Mr. Chairman. I first want to thank you and the members of the committee for holding today's hearing. It's been a long time coming, and I'm glad to see us finally sitting down to tackle this issue that is so important to my home district of American Samoa. I also want to welcome our witnesses who've traveled halfway around the world to be here, including Fauwina Taufte'ejan Fauwina, CEO and Director of LBJ Tropical Medical Center, Dr. Reese Tuato'o. Do I see Dr. Reese Tuato'o? Okay. And Tofoi Taufa Sandra King Young, Medicaid Director for the territory. Thank you all for being here today. Your dedication to your work is much appreciated. Welcome also to Mr. Tom Busanich from the Department of the Interior. This hearing is the result of the CODEL that traveled to American Samoa in February, and I want to thank Chairman Bishop and the members who were able to join us. During the visit, the members were given a tour of LBJ Hospital, the only medical treatment facility on the island. I wanted in the record that our doctors and nurses who work there do an excellent job with the limited resources they have available, and they should be commended for their efforts to maintain the good health of our people. LBJ is approximately a 150-bed facility which opened in 1968 and has since had only minor facelifts, such as the new doors and fresh paint. The capabilities of the facility have largely remained the same. Additionally, further adding to the applause we should be heaping upon our doctors and nurses is the fact that the facility is drastically understaffed, as getting qualified medical personnel to the island has proven to be difficult, an issue that I hope we can find a solution to through this hearing and the work that will follow. The American Samoa Government Operations Account, which is included in the annual Interior Appropriations Bill, provides approximately $7 million annually for hospital operations. That account not only funds a portion of the local hospital, but also the local judiciary, the Department of Education, and local community college. Originated in 1974 at an amount of approximately $17 million annually. Since then, it has been increased only once in 1986 to $22.75 million a year, where it sits today. And if one were to use the standard CPI formula, that amount would now be over $50 million annually. Again, the hospital's take from this appropriation is approximately $7.5 million. Compare that to any other facility of the same size here in the States, and the gap in equity becomes very clear. For example, this year's total budget for LBJ was about $51 million, while a hospital of the same size in Washington State has a 2017 budget of roughly $200 million. The people of American Samoa need better access to care without having to take a flight. The fact is, it is beyond time for a significant increase to the account. The reasoning provided in DOI's budget report for the lack of any increase to the ASG operations account over the years is to promote self-sufficiency on the island, which is all fine and well, but near impossible when at the same time the federal government has closed off large swaths of fishing grounds in the Pacific that our people have used for a millennium and long before any relationship with the United States, and at the same time imposed federally mandated minimum wage laws, irresponsibly putting the territory, which is both economically and geographically isolated, on the same playing field as the states. A policy that has already forced one tuna cannery to leave the island for Thailand, where they pay their workers a mere fraction of what ours are required to pay. I recently introduced legislation to resolve this issue, H.R. 3021, the American Samoa Job Protection and Expansion Act, and I look forward to seeing congressional action on it. Regarding LBJ and any improvements to be made following congressional action, I will be introducing a bill shortly that calls for a GAO study in partnership with DOI, the VA, and HHS to assess the feasibility of either a new or updated facility and I encourage my colleagues to support the measure. It's high time that we here in Congress recognize the issues happening in the insular areas, and I'm encouraged by today's hearing and the action it will bring. Again, I want to thank our witnesses for traveling so far to be here today. I know that the work they do in the islands is indispensable, and I know that their testimony will provide even more insight into the issues we are facing in the islands in regards to providing accessible and quality health care for our people. Thank you, Mr. Chairman. I yield back my time.